Welcome back to The Better Show. Looking for ways to stay healthy without breaking the bank? Dr. Keri Peterson has some great tips and tricks to avoid those costly healthcare pitfalls. Welcome, Dr. Peterson.
Thank you, Sarah.
So you have a great piece of advice that I admit that I always forget. Your flexible spending account.
Max it out. Don't let it go to waste. These are tax-free dollars. So find out when it expires and plan out throughout the year what you're going to spend it on. And keep in mind, most people think it's just for prescription medications, but there's so many other things that are covered. Your copays, your deductibles, even over-the-counter medications. So if you take something like ibuprofen or acetaminophen a lot, go to your doctor, have them write a script for it, and you can turn that in and get an over-the-counter medication for flex spending. Use it or lose it.
I had no idea about that. And eyeglasses as well, is that
eyeglasses,
right?
other medical devices like crutches, bandages, lots of things. And you can look, the IRS has a, on their website, Publication 502 tells you everything that's covered.
Okay, so that's a great tip because I feel like we're all, if you're lucky enough to have a flexible spending account, at the end of the year, you're always rushing to not get rid of it.
Yeah, don't wait till the last minute.
Now, another tip involves the emergency room, which no one wants to go to.
The recommendation is don't go to the emergency room unless it's an emergency. And that seems obvious, but it has been found that 35% of ER visits are inappropriate. And the reason that this is such a healthcare costly pitfall is that the ER is 80% more expensive than the doctor's office. So if you're out of town and you don't know where to go and you're using the ER as a last resort, it really isn't your last resort. It really does provide specific services for true emergencies, something life-threatening or something like you're in severe pain and you can't wait till the morning. If you're not sure, call your doctor and ask them.
Or if you're somewhere else, you can try to get resources for a local physician.
Just Google urgent care center.
Yeah, very simple. Very good idea. Now, what about the differences between an in-network and an out-of-network doctor?
So if you have insurance, please take advantage of it and see a physician who's in-network because the fees for an out-of-network doctor is much higher. Now, you might not even realize that you're going to an out-of-network doctor. For example, I'm an internist. If I recommend a specialist to you, I don't necessarily know if they take your plan. So make sure you call ahead and see if they do. And if they don't, a great resource is a website and app called ZocDoc. You can search by your insurance plan, find someone who's nearby. You can see when their availability is, and you instantly book an appointment online, and then you don't have to worry, are they out of network?
That's a great tip. And, you know, I, for some reason, had all these doctors out of network, and I don't know why. I thought it was going to be too difficult to switch. It's really not. You get your records, you go over. It's so much easier.
Very simple. You just ask for a copy, and you can find, like I said, online who's in your network very easily.
And save a ton of money. Now, generic medication versus brand name. Why are we so attached to the brand names? We don't need to be, right?
We don't need to be. The FDA regulates the generic medications the same exact way that they regulate brand. They require that the active ingredient is identical and that the blood level in the equivalency in your bloodstream is identical to the brand. That being said, there is one area where I would suggest using caution. There is debate as to whether drugs that have what's called a narrow therapeutic index. Now, this means that if you're on too little of it, it's not effective, and if you're on too much of it, it's toxic. These are things like anti-seizure medications and certain blood thinners. If you're on those classes of medicine, just speak to your doctor. Some physicians prefer brand for these narrow therapeutic index drugs.
But otherwise, if you're just going for something like a generic antibiotic,
perfectly
for your kids, it's okay to get.
Save the money, it's perfectly fine.
Okay.
Use generic.
I'm going to ask for that, because sometimes you have to ask for it.
Yes, you just, and sometimes the doctor actually has to write DAW if they want brand, but don't presume that your pharmacist is going to fill it generically. Ask for it.
You have to ask for it. All right, thank you so much, Dr.
My
Peterson.
pleasure, Sarah.
These are all
Thank
great
you.
tips that I will try to implement immediately.
Great.